Below cortex is subcortical area consisting of grey matter and white matter. Most relevant grey matter area is subcortex is basal ganglia. So let's see what the basal ganglia is made of. Okay. Structures of the basal ganglia. Okay. So let's see. Number 1, caudate nucleus. Number 2, putamen. Number 3, globus pallidus. It is divided into two parts. One is globus pallidus interna, another is globus pallidus externa. Okay, so number 4, substantia nigra. Okay, number 4 is substantia nigra, and number 5 is subthalamic nucleus. Subthalamic nucleus we will write in STN, substantia nigra we will write as SNG. Okay, so this much is clear, I think. Okay, I have written the wrong spelling. Okay, so this much I think you have understood. Okay, this is putamen, this is globus pallidus. Okay, now let's come to the below. This is subthalamic nucleus, the upper black portion, and the lower black portion is the substantia nigra. That is putamen is blue color, caudate nucleus I have shown previously. Okay, so thank you. So we have seen the caudate nucleus, putamen, globus pallidus, substantia nigra, and subthalamic nucleus. Okay, so now we are calling caudate nucleus with putamen are called together corpus striatum. Okay, and putamen plus globus pallidus are called together as lentiform nucleus. Okay, so simple, caudate nucleus plus putamen equal to corpus striatum, and putamen plus globus pallidus are called lentiform nucleus. Number 1, complex motor activity. Complex motor activity, what is this? It's like taking a scissor and cutting it exact and accurate position. Okay, so only pyramidal and corticospinal tract cannot do this. It requires the help of basal ganglia. Okay, so you understand, the first one is complex motor activity, like taking a scissor and cutting in exact and accurate position. Not only pyramidal and extrapyramidal tract cannot do this, it requires the help of basal ganglia. Number 2, that is cognitive component of a motor activity. cognitive component of a motor activity. What does it mean? It means making a plan subconsciously before carrying out the activity. Okay, so I want to make a plan. Everything, I want to touch a pen, I want to pick up a pen, I want to hit him. Okay, so I have to any activity I want to carry out, first I have to make a plan, maybe some subconsciously or consciously, mainly subconsciously. Okay, so number 3 is timing and scaling of activity. Timing and scaling of activity, like when you want to play a shot in a cricket match, you have to first timing the ball accurately according to its speed, according to its line and length. Then you hit the ball with the amount of power it needs, maybe for a single run, for a 4, or for a over boundary 6. So this is an example of timing and skilling. A ball comes to a bat, first timing, then according to its speed, line and length, and lastly with adequate power. Okay, so all these 3 functions are carried out by basal ganglia. So number 1, complex motor activity. Number 2, cognitive component of a motor activity. Number 3, timing and scaling of activity. Okay, so it's a very important topic, and just understand the concept. Now let's see the basic connections in basal ganglia. But first you have to remember some basic rules, and they are: number 1, all the inputs come to stratum from cortex, and all they are stimulatory. Okay, all the inputs come from stratum from cortex, and they are stimulatory. Number 2, all the outputs come out through globus pallidus interna segment. Okay, all the inputs come to stratum from cortex, they are stimulatory. All the outputs come out through globus pallidus interna segment. And number 3, what is? All the intrinsic circuits within basal ganglia are inhibitory. Okay, but those arise from subthalamic nucleus are excitatory. Okay, I hope you remember the rules before we going into the connections within basal ganglia. The 3 rules you have to remember. Number 1, all the inputs come to striatum from the cortex, they are stimulatory. All the outputs come out through globus pallidus interna segment. And number 3, all the intrinsic connections within basal ganglia are inhibitory in nature except those arise from subthalamic nucleus, they are excitatory. Okay, good. So now you have to know about the 2 pathways. One is direct pathway and number 2 is indirect pathway. So to understand the pathway, first we have to know what is the circuit. And the circuit consists of, number 1 is cortex, second one is striatum, third one is globus pallidus interna, and fourth one is thalamus. Okay, so according to rule number 1, what I have said that all the stimulus, excitatory stimulus, comes from cortex to striatum. Okay, so excitatory stimulus coming from cortex to striatum, and striatum gets excited. Okay, so and according to rule number 2, all the outputs from basal ganglia comes out through globus pallidus interna, that is this globus pallidus interna. And I have said that all, according to rule number 3, all intrinsic connections are inhibitory except from subthalamic nucleus. So subthalamic nucleus is not present here, so I am excluding it from present conversation. So now let's deal with this. So excitatory stimulus comes from cortex to striatum. Striatum normally inhibits globus pallidus interna. Okay, and globus pallidus interna normally inhibits thalamus. Okay, so now if we start the circuit from the first, the cortex stimulates striatum, so striatum gets stimulated. So after getting stimulated, striatum inhibits globus pallidus interna. So as globus pallidus interna gets inhibited, so it cannot exert its inhibitory action on thalamus. Understand? Normally globus pallidus interna give inhibited thalamus, but as the striatum inhibits the globus pallidus interna, how? By the stimulation from the cortex. Cortex stimulates striatum and striatum gets stimulated, activated. The activated striatum will inhibit the globus pallidus interna. So when the globus pallidus interna gets inhibited, so it cannot exert further its inhibitory action on thalamus. So thalamus remains excitatory and it exerts stimulatory effects on cortex. Okay, so this is the direct pathway. Understand? I am telling you one more time. Cortex exerts its stimulation on striatum. So striatum gets activated. Striatum gets activated. What does it do after it? It inhibits globus pallidus interna. And after globus pallidus interna get inactivated, so they cannot inhibit thalamus further. The inhibitory action on thalamus is gone. So thalamus will be excitatory in nature and it exerts its excitatory effect on cortex. Okay, so this is the direct pathway, and so the we call the direct, and that's why this direct pathway is stimulatory. Okay, understand? I think you have understood this very simple concept. Cortex activated stratum inhibits GP interna. GP interna cannot inhibit thalamus further, so thalamus remain stimulatory to cortex. So the direct pathway is stimulatory. Let's read another pathway, which was indirect pathway. We have previously read about direct pathway, which was stimulatory to the cortex, but here we will learn about the indirect pathway. So you are seeing the circuit for the indirect pathway. It's little bit complicated, but bear with me, it will be very easy for you. Now, as all of you know, cortex sends stimulatory signals to striatum. Okay, striatum gets activated. Striatum inhibits globus pallidus externa. Okay. Now, normally globus pallidus externa inhibits subthalamic nucleus, but as here as the activated striatum inhibits the globus pallidus externa, so the inhibitory effect of globus pallidus externa to subthalamic nucleus will be absent, will not be present. Okay, so remember rule number 3, what I have said. The rule number 3, that all intrinsic connections among basal ganglia is inhibitory except those arise from subthalamic nucleus. So that is, subthalamic nucleus will send stimulatory signal to globus pallidus interna. Globus pallidus interna, you know, according to rule number 2, it is the main output of the basal ganglia. Okay, so subthalamic nucleus sends stimulatory signal to globus pallidus interna. Normally, what does globus pallidus interna do? It inhibits thalamus. Okay, so the activated by subthalamic nucleus, it will inhibit the thalamus. So as thalamus is getting inhibited, so the inhibitory signals to the cortex will be sent. The cortex the signals will not be stimulatory. Okay, understand? I am going to one more round. Cortex sends stimulatory signals to striatum. Striatum gets activated. Activated striatum will inactive globus pallidus externa through inhibitory signals. As globus pallidus externa is inhibited, the normal inhibitory output to subthalamic nucleus from globus pallidus externa will be absent. So the subthalamic nucleus will now only send stimulatory signal as of rule number 3 to globus pallidus interna, as it is the main output of the basal ganglia. And normally globus pallidus interna sends inhibitory output to thalamus, so it will be present. Thalamus will be inhibited and thalamus will send inhibitory signal to cortex. So this is the indirect pathway. So we can say that indirect pathway is inhibitory in nature. So direct pathway was stimulatory in nature, but indirect pathway was inhibitory. So the main funda here is the direct pathway and the indirect pathway. So direct pathway is stimulatory nature to the cortex, is stimulatory to cortex, means it activates agonist muscles to carry out the work. And what does indirect pathway do? Indirect pathway means it inhibitory to cortex, means it inactivate the antagonistic muscles. So the work can be done smoothly. These are the funda. I hope you have understood all. Stimulatory direct pathway is stimulatory to cortex. It activates the agonistic muscle which will carry out the work. Indirect pathway, it is inhibitory to cortex, which means it inactivates the antagonistic muscles so that work can be done smoothly. So now let's come to the main area of our discussion, that is Parkinsonism. As previously I have shown you the figure, one of the most important area in the brain related to the disease process is Parkinsonism, and that is substantia nigra. So substantia nigra, it is connected to cortex via two kinds of receptors, that is dopamine 1 receptor and number 2 is dopamine 2 receptors. So what does it do? Main function is via dopamine 1 receptor, it stimulates direct pathway, and via D2 receptor it inactivates indirect pathway. So what does direct pathway do? The direct pathway it stimulates the cortex, that substantia nigra does via D1 receptor. And what does indirect pathway do? It inhibits the cortex, but D2 receptor causes inactivation of this indirect pathway. Okay, so substantia nigra via D1 receptor causes stimulation of the direct pathway, activation of the direct pathway. Substantia nigra via D2 dopamine receptor causes inactivated the indirect pathway. So mainly it only stimulates or activate the direct pathway. So in a word, substantia nigra activates direct pathway to stimulate the cerebral cortex. Got it? It is very simple. What finally happens in Parkinson? The main pathology in Parkinson is that there will be loss of dopaminergic neurons in substantia nigra. There will be loss of dopaminergic neurons in substantia nigra. So there will be no one to activate the cortex. So all the movements will be slow, and this is the hallmark of Parkinsonism, and that is bradykinesia. In Parkinson's disease, there will be loss of dopaminergic neurons in ascent, substantia nigra. So there will be no one to activate the cortex, no direct pathway. Only indirect pathway will remain, and indirect pathway does what? It inhibits the cerebral cortex. So the cerebral cortex will be inhibited, and all the movement will be slow. And this is the hallmark of the Parkinsonism, that is bradykinesia. Okay. And so I am ending the discussion here. Further discussion of Parkinson's disease is typical, atypical, and feature, classical feature will be done in next videos. Okay.